Welcome to Module 5 of Day 1 of the TCCC-Plus course. Here we will cover packing a junctional or deep limb wound onto the bleeding source, packing a neck wound, and holding pressure on the wound packing. As previously mentioned, some wounds cannot take a tourniquet. The groin, the armpit, the base of the neck, and deep wounds high on the limb where a tourniquet will not sit properly. These junctional wounds hold big vessels and bleed fast, and the answer to this problem is to pack them with gauze or other packing materials. We pack them hard, onto the bleeding point, not just willy-nilly. The same skill can be used on extremity wounds, to be able to convert a tourniquet, but should not be used on the chest or abdomen. Again, some wounds can be packed, others not. We pack junctional wounds and deep limb wounds where we can't get a tourniquet on properly, as well as when we plan to convert a tourniquet. Never pack the chest, the abdomen, or the skull. Packing a chest, abdomen, or head wound does nothing useful and can do harm. An open chest wound gets a seal, not packing, and we cover that later. Package is not randomly stuffing gauze into a hole. You have to find the bleeding vessel inside the wound and press the gauze directly onto it, against bone if you can. Think of it like a squirt gun. A finger near the nozzle does nothing, a finger on the nozzle stops it. If the wound is in the groin and you cannot reach the source, kneel into the groin with your fist to buy a moment while you pack. Try to get a finger onto the bleeding point, then feed gauze in around it. You have to pack the wound tight, feed the gauze in a little at a time and pack it down hard, filling the whole cavity, while keeping firm pressure on the source the whole time. A loosely packed wound keeps bleeding. Many different products for packing exist, but simple plain gauze works well. In swine studies of a deep groin bleed, plain gauze packed correctly gave essentially full survival at 2 hours. A hemostatic gauze, such as the kaolin-impregnated radio-opaque combat gauze, helps the blood clot faster on top of good packing, but the packing technique matters more than the product. Packing is pressure delivered directly to the source. Try to find the bleeding vessel at the base of the wound, put your finger on it, and feed gauze in hard against that point until the cavity is full. Then press and keep pressing. You are not stuffing a hole, you are holding an artery shut with gauze and your weight. After packing is done, hold pressure for a minimum of 3 minutes for hemostatic dressings, 10 minutes for regular gauze before releasing pressure carefully and dressing with a pressure bandage to keep the packing in place and under pressure.
Hello, my name is Kyle and I'm an active duty Army 68 Whiskey combat medic. I'm going to teach you how to properly apply a pressure bandage. You should apply a pressure bandage over a wound packed with a hemostatic dressing after direct pressure has been applied for 3 minutes. First, remove the bandage from the pouch and packaging. Next, expose the sterile portion of the bandage and place it directly over the hemostatic dressing or open wound and apply pressure. Wrap the elastic bandage around the wounded extremity while continuing to apply direct pressure. If using a dressing with a pressure bar, insert the elastic bandage completely into the pressure bar and reverse wrap it on itself. Pull the elastic bandage back over the top of the pressure bar. Reversing the wrap back over the top of the pressure bar forces the bar down into the pad. Wrap the elastic bandage tightly over the pressure bar. To ensure tightness, use short tugs and stretch the bandage fully, but be careful not to pull gauze out or off the wound during wrapping. Continue to wrap the elastic bandage around the limb so that all edges of the pad are covered. Secure the hooking end of the closing bar into the elastic bandage. If you are using a bandage with a Velcro end, pull up a piece of the wrap and secure it on the top and bottom with the teeth tabs. The bandage is now secure. Assess the circulation below the pressure dressing. If the skin below the pressure dressing becomes cool to the touch, bluish, or numb, or if the pulse below the pressure dressing is no longer present, the pressure dressing may be too tight, and you will need to loosen and re-secure the dressing. As always, when you have finished your initial care of the casualty, document treatment on a DD 1380, Tactical Combat Casualty Care Card. Once other medical personnel arrive, inform them of your findings and treatment, and assist with evacuation as requested.
Watch the packing done properly. The hand goes right to the source of the bleeding, deep inside the wound, not dabbed on top. Gauze is fed in tight and packed down hard, filling the cavity until it is full, then held with firm pressure. This is technique over product. It is the pressure onto the bleeding vessel that stops it, not the brand of gauze. Watch where the fingers go, how hard the packing is, and how the pressure is held without peaking. Again, once it is packed, hold firm pressure, about 3 minutes for hemostatic gauze, about 10 minutes for plain gauze. Hold it, do not peak. Then put a pressure bandage over the top to keep it in place and reassess. If it keeps bleeding, consider repacking with more gauze or new hemostatic gauze. The neck is its own problem because you cannot wrap it tight all the way round without choking the casualty. There is a famous video of a Russian soldier trying to apply a tourniquet to his neck, a move we do not recommend. For a bleeding neck wound, pack it, one side only, pressing the bleeding point against the deeper structures, and hold. Then secure the packing with a dressing anchored under the opposite armpit and over the shoulder, never circumferentially around the neck. And watch the airway closely, because a neck wound bleeds and swells at the same time, and the swelling can close the airway faster than you expect. Control the bleeding, secure the packing, then keep one eye on the airway and be ready to position or escalate. Here is an illustration of treating a neck wound as previously described, which we will return to later. Again, common errors include packing loosely or not onto the source, packing the chest or abdomen, wrapping the neck all the way round, and not holding pressure for the full time. To recap, pack junctional and deep limb wounds, never chest, abdomen or skull. Find the source, pack hard onto it, fill the cavity. Hold pressure, 3 minutes hemostatic, 10 minutes plain. For the neck, pack one side, anchor under the opposite armpit and watch the airway. Dressing over the top, then reassess. Thanks for watching our TCCC-Plus for non-medics Day 1, Module 5 about wound packing. Next up is Module 6, pressure bandages.